And now, chapter 4. Do not give them an excuse to throw you away. Real stories. The good. Last year after surgery, I went to PCP and told her that I was abusing my meds and I wanted to get off them. She couldn't give me Suboxone, so I went online and got it. But I was labeled by PCP as an opioid use disorder. So in March, I went to a new PCP at the same clinic. The original PCP moved to Austin. I told my new PCP my story and what I've been through. I told him I was in more pain now than before the surgery and needed some meds. I asked him to only give me a 2-week supply and drug test me. We agreed to a short-term plan until I can see pain management again. He gave me a second chance. But I made sure we had an agreement on the 2 weeks, and we agreed to hold each other accountable. That's my second chance, Doc. All because the doctor refused to judge me by my stated past. Hope this helps someone. Healthcare is not inherently fair. If it were, then the most disenfranchised, vulnerable patients would have easy access to care. Instead, what I see is that the most vulnerable patients are being systematically shut out of all but emergency care. They get temporary Band-Aids applied, and no one is tasked to keep them safe. I call these patients the throwaway patients. A throwaway patient is one who has been deliberately squeezed out of most healthcare institutions because of their perceived drain on the bottom line. Among them are government insured, especially Medicaid, private pay, the high deductible policy holders, and the homeless. Yet this is the system that you must negotiate, even if you're a member of one of these groups. And doing so requires that you remember their objective pertaining to you. Their aim is to keep the total percentage of their care to your group as small as possible. So they set up discriminatory rules that are easy to follow for folks who have stable transportation, stable jobs, stable medical conditions, and stable income. But when you have an issue in any one of these areas, your ability to follow the supposedly simple rules of number 1, do not cancel at the last minute, number 2, payment must be rendered at time of service, number 3, multiple reschedules will cause you to be dismissed, number 4, show up 15 minutes early for your appointment, number 5, patients that show up 15 minutes late will be rescheduled, become huge barriers to care. Break these rules too often, and you'll find yourself exactly where they intend you to be, outside, alone. So the hardest advice I will give you in this book is simply this: do not give them this chance. Always remember what is at stake. The flockers, a nice slightly off-color term for everyone and everything standing between you and your health care, do not get to keep you from the care you deserve. I'm going to say that again. The flockers do not get to keep you from the care you deserve. If you were going to negotiate care in a system that all too often doesn't care, there are a few rules that you must follow even if the system does not. The first among them is you will have to be seen keeping your promises. Whether or not you say the words, "I promise," when you accept an appointment, a prescription, an order for a preventive test, or give consent for surgery, you are promising that you will complete whatever task you accept. What is doubly frustrating is that the system you are trying to get care from will not hold themselves to the same standard. They will cancel on you often, and the temptation will be to withdraw from care. No one should have to be treated so unfairly, so systemically. But again, this book is not about fairness. If the fairness doctrine worked, my book would be completely unnecessary. They will be ready to disregard you, belittle you, condescend to you. But I promise you this, there are wonderful, loving care providers out there, even in this system that's trying to shut you out. But to find them, you must stay engaged and keep reading. In most companies that I've interacted with, the system works, but the people screw it up. In healthcare, it's different. The people are great, but the system stinks. Is a more correct paradigm. Most folks in healthcare want to know in their hearts that they're making a difference. Many of them chose healthcare because they wanted to see people get the same care they felt they were denied when they tried to interact with the system. Given the systemic barriers in care that are in place, you can imagine how many folks get jaded and can become callous over time when they realize they're less impactful than they hoped. I'm pointing this out because I need to remind you that you are rarely being singled out when you're feeling disregarded. Often the person in front of you wants to help, or at least at one time they did. Rule number 2, therefore, means you must be nice to folks who may be triggering or gaslighting you. Did you see why I talked about your advocate before? Even at my office, where patients are genuinely loved and cared for, the quickest way to not be a patient is for you to yell at or engage in arguments with my staff. I can take a lot as your provider. If you need to unload, my exam room is often a safe place, but I love my staff as much as I do you. And if our systems are making it hard on you, it is most often not their fault. Now, if this unspoken rule exists in my oasis of paradise care, full sarcasm intended here, imagine how much easier it is to be dismissed from every other practice in the country. You must keep your temper. Most employees of healthcare have been traumatized by the system as much as you have and are on the brink of giving up in the same manner. Check out staff turnover rates in healthcare if you doubt this. Go ahead, Google. Therefore, the front desk especially is often a volatile place and the single easiest location to dismiss you from. If they are rescheduling you, keep your temper. If they say you have a balance, calm down. If they say the doctor is running behind again, smile and say thank you for the update. Once again, fairness to you is not the issue here. You can get yourself in trouble when you expect fairness, but the better you control yourself, the more effective your advocate is, the fairer the fairer the system does, in fact, become. I'm going to reread that because I think I kind of butchered it. You can get yourself in trouble when you expect fairness, but the better you control yourself, the more effective your advocate is, the fairer the system does, in fact, become. Rule number 3 is that you, to the best of your abilities, must follow the plan given to you by your provider. If you say you're going to take a medication and you're going to take it in a certain way, follow the plan even if it's not working until your next appointment. Common sense is needed, of course. If you begin to sprout a 6th finger on your left hand, stop the medication. But your ability to follow the plan of care directly affects your ability to engage in shared decision making. If you stop every medication after 2 days because I did not like how that made me feel, you will quickly find your provider disengaging from your care because they do not feel that they can help you. If you are worried about how long you are going to have to tolerate a medication that makes you feel bad, make your follow-up appointment as soon as possible after starting the medicine. I tell new providers, the best remedy for a plan that sucks is a short interval follow-up. Again, if you're worried about how long you can be patient, tell your provider this and agree on a time frame of how long the trial of treatment requires before the two of you agree it's not working. But again, hold on a second. There you go. But again, follow the directions. When you left the office, you made an implied promise to follow the plan of care. So do it. Shared decision making, something you should strive for as a patient, requires one specific thing: what each side promises they do. Chapter 4. I love y'all, no buts.